Today, we will continue our discussion on the topic vitamins. Last class, we have already learned that vitamin is an organic compound which is required in the diet in small quantities and it's required for the maintenance of normal metabolic integrity. Today, we will discuss about vitamin C, its sources and biochemical functions. So, chemistry. It is a water-soluble vitamin and it is easily destroyed by heat, alkali and storage. In the processing of food, 70% of the vitamin is lost. The structural formula of ascorbic acid closely resembles that of carbohydrates. The strong reducing property of vitamin C depends on the double bonded carbons. Only L-ascorbic acid and dehydroascorbic acid have anti-scorbutic activity. The D form of ascorbic acid has no activity. Most animals and plants can synthesize ascorbic acid from glucose. But in man, higher primates, and guinea pigs and bats are the only species that cannot synthesize ascorbic acid as the enzyme malonolactone oxidase is absent in them. And which are the sources of this vitamin? Leafy vegetables and fruits, especially citrus fruits, strawberries, tomatoes, spinach, and potatoes. Amla is a very rich source of this vitamin. Lemon and guava are also good source of this vitamin. And what is the RDA or recommended daily allowance? It's about 60 to 70 milligram per day. And additional intakes are recommended in women during pregnancy and lactation. And cigarette smoking can increase ascorbic acid turnover due to free radical scavenging by the vitamin. So these are the foods rich in vitamin C. You can see here lemon, orange, banana, tomato, cabbage, etc. Now we will learn about the metabolism of ascorbic acid. It is readily absorbed from the gastrointestinal tract. And oxidation of ascorbic acid yields dehydroascorbic acid, which is oxidized further to oxalic acid. Ascorbic acid is partly excreted unchanged and partly as oxalic acid. And most of the oxalates in urine are derived from ascorbic acid and rest from glycine metabolism. It is excreted in urine. And since vitamin C is a strong reducing agent, the Benedict's test will be positive in the urine sample after vitamin administration. And what are the biochemical functions of vitamin C? It can change between ascorbic acid and dehydroascorbic acid, and most of the physiological property of the vitamin can be explained by this redox system. And vitamin C is a coenzyme of two groups of hydroxylases, copper-containing hydroxylases and alpha-ketoglutarate iron-containing hydroxylases. So, it plays an important role in the hydroxylation of proline and lysine. Proline hydroxylase and lysine hydroxylase of the enzyme. And ascorbic acid is necessary for the post-translational hydroxylation of proline and lysine residue. Hydroxyproline and hydroxylysine are essential for the formation of cross-links in collagen, which give tensile strength to the fibers. This process is absolutely necessary for the normal production of supporting tissue such as osteoid, collagen, and intercellular cement substance of capillaries. Since vitamin C is required for normal collagen formation, vitamin C is also involved in bone and tendon formation as well as wound healing process. It also plays a role in tyrosine metabolism, folic acid metabolism, and also involved in synthesis of catecholamines. Vitamin C plays an important role in iron metabolism. Ascorbic acid enhances the iron absorption from the intestine, and it reduces ferric ion to ferrous state, which is preferentially absorbed. It plays a role in bile acid formation and steroid synthesis also. And it acts as an antioxidant. Ascorbic acid acts as a general water-soluble antioxidant and may inhibit the formation of nitrosamines during digestion. And regular intake of ascorbic acid reduces the risk of cataract formation. So what are the deficiency manifestations of this vitamin? Scurvy is the classical syndrome of vitamin C deficiency. And symptoms of scurvy are related to deficient collagen formation. And which are the symptoms? Bleeding tendency, muscular weakness, soft, spongy, swollen, bleeding gums, and loosening of the teeth, abnormal bone development, and osteoporosis. In children, bone formation is impaired and poor wound healing. These are all the characteristics of vitamin C deficiency. Anemia due to impaired erythropoiesis is also seen, and milder forms of vitamin C deficiency are more common, and manifestations of such include PC bruising and formation of small pinpoint hemorrhages under the skin, which are called petechiae. You can see in this diagram. Hemorrhagic tendency. In ascorbic acid deficiency, collagen is abnormal and the intercellular substance is brittle. So, capillaries are fragile, leading to tendency to bleeding even under minor pressure. Subcutaneous hemorrhage may be manifested as petechiae in mild deficiency. And in severe cases, hemorrhage may occur in the conjunctiva and retina. And what are the symptoms in oral cavity? In severe cases of scurvy, the gums become painful, swollen, and spongy. The pulp is separated from the dentin, and finally teeth are lost. Wound healing may be delayed. Atrophy of ameloblast and odontoblast occur in vitamin C deficiency. And in bones. In the bones, deficiency may result in the failure of osteoblasts to form the intercellular substance osteoid. Without the normal ground substance, the deposition of bone is arrested. The resulting scorbutic bone is weak and fractures easily. In anemia, microcytic hypochromic anemia is seen in vitamin C deficiency, and this may be due to loss of blood by hemorrhage or decreased iron absorption or in decreased tetrahydrofolate. What are the therapeutic uses of vitamin C? Vitamin C has been recommended for treatment of ulcers, trauma, and burns because of its power to heal wounds. The role of vitamin C in preventing cold and cancer has not been scientifically supported. Although the incidence of common cold is not reduced by this vitamin, the duration of cold episodes and severity of symptoms can be decreased. So by this, we come to the end of this session. Thank you.